Anxiety is a common mental illness that affects approximately 18% or 40 million adult Americans over the age of 18. There are many variations to anxiety disorders, which can cause it to be difficult to diagnose. Symptoms may develop unnoticed but may progress to be detrimental mentally, physically, and/or emotionally, and are unique to the individual. Anxiety may be treated with treatments that can address each specific case. There are many types of anxiety, including generalized anxiety disorder, panic disorder, social anxiety disorder, otherwise known as a social phobia, separation anxiety, agoraphobia, the fear of being in a place or situation that may cause panic or helplessness, substance-induced anxiety caused by alcohol, amphetamines, caffeine, cannabis, commonly known as marijuana, cocaine, hallucinogens, inhalants, phencyclidine, and any related or unknown substances, and specified anxieties or anxieties from root cause. Some causes include type A personalities, gender, females primarily, genetic makeup, and drug and/or alcohol abuse. Physical effects for anxiety include oxidative stress in cells. Oxygen is needed for cells to properly function, and brain cells can be affected without proper oxygenation. It also impairs the nervous system, causing physical effects. Impairment of the mental performance may occur as well as disturbed sleep and lowered energy levels. Anxiety can open doors to depression, substance abuse, and insomnia, and headaches. Anxiety causes a weakened immune system and will cause the release of cortisol. A prolonged use of cortisol suppresses white blood cells, which causes the immune system to be susceptible to germs. Irregular digestion is commonly effective anxiety due to the sympathetic nervous system coming into play, and the rest and digest or parasympathetic nervous system is replaced. The heart is also put under excessive stress when anxiety is present. Perhaps one of the most obvious signs of anxiety is excessive worry. It is not clinically considered anxiety until it occurs most days of the week for a greater duration than 6 months. This excessive worry typically interferes with daily life. Anxiety also presents itself with irrational fears, panic attacks, and self-consciousness that impact social life that can cause blushing, trembling, nausea, profuse sweating, and difficulties when talking. Many suffering from anxiety have flashbacks about flawed or traumatic moments, perfectionism, and self-doubt. Anxiety also comes with physical symptoms like muscle tension, chronic sleep problems, and chronic indigestion. Keep in mind that muscle tension in these cases is constant and can often become unnoticed by the victims. Anxiety disorders present both short-term and long-term consequences if left untreated. Short-term consequences include difficulty swallowing, dry mouth, rapid breathing, headaches, irritability, muscle tension, shortness of breath, trembling, twitching, dizziness, rapid heartbeat, fatigue, inability to concentrate, muscle aches and nausea, and sweating. These can often be indications of anxiety. Long-term effects also include an increased risk of stroke, premature memory decline, insomnia, and a detrimental impact of emotional distraction. Treatments of anxiety can include medications that increase or stabilize neurotransmitters in the brain. There are also many types of therapy that are used in each specific situation. Cognitive behavioral therapy is the most common form of therapy and is very client involved. That is why it is so effective. Other forms include exposure, acceptance and commitment, dialectical behavioral, interpersonal, and eye movement desensitization and reprocessing therapies. Prevention is one of the most important steps in recovery from anxiety disorder. Although techniques can vary from person to person, some popular prevention techniques include getting help early on with recurring symptoms, keeping a journal, staying active, practicing time management techniques, and avoiding alcohol or drug use. Anxiety disorders are common within American society. Diagnosis, treatment, and prevention may all be difficult, especially with progressed anxiety. Failure to treat the disorder can open doorways to detrimental consequences that can result to self-harm and/or suicidal thoughts. Prevention is the only surefire way to keep symptoms and flare-ups out of the picture in order to maintain normal daily function.